The Illinois Department of Public Health finds discrimination is behind a majority of deaths related to Black pregnancies.
Yeah, Nathaniel Langley learns new education taking effect this year plans better care for all expectant mothers.
Daniel Sidney, the IDPH reports significant disparities exist for women of different race, class, and geographic backgrounds. A mom and newborn care specialist claim it's an inconsistency experienced even here in Winnebago County.
I feel like I had to really push for things.
Carissa Douglas faced health issues after the birth of her daughter.
I actually searched on the internet to find out what was going on and kind of brought it to my doctor.
The Roscoe mom claims her doctor brushed aside the concerns.
It wasn't anything life-threatening or serious, but it still was frustrating to not be taken seriously right away.
Douglas attests racial disparities exist in maternal health care, especially for Black women.
It's like our pain tolerance almost is meant to be higher. So when we complain of something, it's not taken as seriously as somebody else might be taken.
The Illinois Department of Public Health finds amid rising pregnancy-related deaths, Black moms face the highest rate of maternal mortality.
It definitely is a little bit shocking.
Statistics show for every 100,000 live births in the state, 78 Black women die. Discrimination was present in 74% of deaths.
As a birth professional, it's terrifying because
Rebecca Iverson leads Seraphic Baby Care in Rockford.
I want all women to be successful in giving birth and have healthy babies and have healthy pregnancies.
Starting July 1st, Illinois requires anti-bias training for pregnancy care providers.
We need to work to educate people on how these women need help.
The education lasts an hour with a focus on historic racial discrepancies in maternal care. Iverson calls it a great start.
But we need to work with insurance companies and we need to work with hospitals to get more of this care into these women's hands.
I hope that, the providers take it more seriously, the healthcare systems take it seriously, and we see some improvement.
The IDPH supplied recommendations to reduce pregnancy-related deaths. Some included more maternal health providers in hospitals to employ a social worker with postpartum case management.
Iverson suggested the Rockford area can improve in maternal mortality with more access to birth doulas. She says despite rising awareness, the community lags behind others with its offerings.